The Biden administration has declared a state of emergency in response to the monkeypox outbreak. We talked to Dr. Anthony Fauci to discuss the facts and how you can stay safe. I'm Justin Carter. TSR News starts right now. Public concern over the rising number of reported cases of monkeypox is increasing, and the facts around how the virus is spread and who is more impacted still remains widely unclear. I caught up with Chief Medical Advisor to the President and the Director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, for insight. Is this a real big cause for concern moving forward as these cases rise?
Well, I think you have to strike a balance, because when you say a cause for concern, you don't want people to panic as if all of a sudden the tenure of society is going to change. However, one thing that we have learned through, in some cases, painful experience is never underestimate the potential of a disease outbreak. In the United States, we have over 11,000 reported cases. It's predominantly at present, rather overwhelmingly, more than 98% or so, among men who have sex with men, almost certainly because the virus has inserted itself into the sexual networks of gay men, particularly when people get together and have sex, sometimes with anonymous sexual partners that they've never met, which is the perfect setting for the spread of a disease that's spread by close skin-to-skin contact. However, as we've also learned from experience with HIV back in the very early years of the 1980s, that it may not stay confined to a particular demographic group. And we've already seen situations where it's gone out of the cohort of men who have sex with men, particularly involving children and some women. So the short answer to your question is that we can do something about this. We have diagnostics, we have vaccines, we have therapeutics. We've just got to implement them as expeditiously, with equity, as we possibly can. And I believe we can get control of this outbreak. So in that respect, I think if we do things correctly and we do it expeditiously, that we'll get control of this, and it won't be something that will, over an extended period of time, be a matter of concern. But if we don't take it seriously and we don't work in a consorted, expeditious manner to get the equitable distribution of countermeasures, it could get much worse.
Why are people thinking that this is an STI and just a virus that's just caught by men who have sex with men?
Strictly speaking, a sexually transmitted infection is one that is transmitted only during sexual interaction. Although close skin-to-skin contact is obviously one of the hallmarks of sexual interaction, that the virus is spread in that environment. However, unlike other sexually transmitted infections, it can be spread by skin-to-skin contact outside of the sexual context. It can also be spread by inanimate objects, such as when you get lesions, some of the pus or material from a lesion will get on bed clothings or clothing or other inanimate objects, that it could be spread that way. Also in the healthcare setting, when healthcare providers are not properly protected with the appropriate personal protective equipment, none of that is sexual. So therefore, even though the virus can be spread and is predominantly spread in the sexual context, it is not the only way the virus can be spread.
As kids do go back to school, what can parents or maybe even teachers do to prevent our kids from getting this virus?
Well, I think it's just to be aware if children complain of illness, have a rash that is not explained, that awareness that this possibly could be monkeypox. Now, you don't want every single little rash that a child gets to there be a great suspicion it's monkeypox. That could create a degree of stigmatization, which is be very inappropriate. But I think just some prudent awareness that this is something that can afflict children. If, for example, accidentally someone who does have monkeypox on their hands or on a part of their body when they touch or hug a child, that a child could get infected. In fact, we've seen that already happen. So I would think it'd be awareness on the part of physicians, school nurses, teachers, and those who are involved in a personal way with children.
Some parents are going as far, Dr. Fauci, as saying, you know what, I think I'm going to homeschool my kid this year.
I think that's a little bit over the edge on this. So I would be careful. Worrying about monkeypox in school is really something you don't want to completely disregard, but you don't want to make major changes like the extreme that you mentioned of not sending a child to school. That would be really inappropriate, I believe.
Okay. And, let's kind of go back a little bit. You just mentioned just skin to skin contact or even, fabric to fabric. I mean, does this virus, can it live on the palm of my hand? Can I transmit it or transfer it to someone if I'm giving someone cash at the gas station or if, I'm handing my mom, something in the house? I mean, is it that contagious?
Well, it is contagious to be sure, but everything is relative. I think there needs to be more than just passing contact. You have to have, with no guarantee. I mean, you could get it transmitted if you have it on your hand with a blister or a pustule and you touch someone else. That's the way it gets transmitted. There's no walking away from that. That is a fact. And that's the reason why in the question you asked me a little bit ago, that what can one do? One can be alert to the possibility that there is monkeypox in society. And when you see an unexplained rash, to just question it.
What should I first do if I suspect that I have it?
Well, you should call a healthcare provider and ask advice. You may ask you to come to the office and take a look. I may ask you to go to an emergency room to have someone take a look at it. But certainly you want to make contact with a healthcare provider.
Okay. Within the Black community, let's talk about it. Is this virus more prominent within the Black community? Have those numbers kind of skyrocketed within our community, or is it just more widespread across the board?
Well, I mean, initially it was felt to be more prevalent in the white community, and we're starting to see more and more that, particularly in the sexual context of African-American men who have sex with men, that it's looking like it's becoming more prominent in that group.
If I do believe, if I'm not showing any signs or symptoms now, or I believe somebody has it and I may have been exposed to it, what should I do?
You should look on your skin for lesions that might be suspicious of this. Also, it isn't only just rashes and pustules on the skin. You can have fever, you can have lymphadenopathy, you could have general systemic illness.
Dr. Fauci says symptoms to look out for include fever, chills, swollen lymph nodes, exhaustion, muscle aches, body aches. He says that so far, about 635,000 doses of the vaccine have been distributed. Another 400,000 is on the way. He says that the FDA has also approved additional ways to administer the vaccine as well so that it can stretch and more people can receive it. I'm Justin Carter for TSR News.